There it is. It's part one, the spinal cord. And we're in the central nervous system. We finished with the brain and some of the processes of the brain. And now we're switching over to an entirely new structure here, the spinal cord. So the central nervous system consists of the brain and the spinal cord. And I tried to articulate to you early in this process that when we are born with only 1/3 of a brain cortex. Only 1/3, and that the rest of the 2/3 of the brain develop over the period of the next 5 years of life, mostly in the early part of the 5 years, but there is still some things going on in that last final 5th year of life, even some very tiny things that continue to develop, but only in a very, very rare and small and minute way for years shortly after, maybe until 9 or 10. But generally speaking, things are pretty much done by age 5. So here's our spinal cord. And the other thing that you need to know about this is that we're finished with it, again, by age 5, which means we keep growing. In fact, most of our height, bursting especially, comes way after age 5. If you know the height of the average 5-year-old compared to the average 21-year-old, you'll note that there is going to be some changes. So in fact, the spinal cord itself ends relatively early here. This is the spinal cord right here, and it's going to end at the level of L1 and L2. The disc between L1 and L2 is the average length of a spinal cord in the average height, woman or male. It's going to be at the disc between L1 and L2. If you're really tall and you grow much more quickly in your skeletal system, then in fact it might end only at L1 or even at T12. Whereas if you're quite short like me, I'm only 5'1", then in fact you might expect the end of the spinal cord to be a little bit lower. And so that means that the skeletal system hasn't grown quite as much in the shorter individual. Okay, so here we have the spinal cord, where you recall that we have spinal nerves coming out every so often at certain intervals. And one of the things that you will note is that the spinal cord can exit the vertebral canal through an opening between the two vertebrae called the intervertebral foramina. Okay, there's a foramen at the level of the pedicle. So there's a notch at the pedicle through which the spinal nerve will pass, and then it will immediately divide into primary, anterior, and posterior branches. Okay, so spinal cord right here. We're going to have certain areas in which there is an enlargement. This is called the cervical enlargement, and it more or less correlates to C5 to T1. And it has to do with the brachial plexus because we have a lot more cell bodies that have to serve the upper extremity for musculature and skin sensation. Okay, and so as a result of that, we're going to be having quite the significantly larger area here, or volume, for this C5 to T1 area, the cervical enlargement. Similarly, down here, we have a lumbar enlargement that is representative of all of the nerves that are going to be coming out in a complex manner to serve the lower extremity, the thighs, compartments of the thigh, compartments of the leg, the feet, so on. So we need a lot more cell bodies in the especially anterior and the anterior horn. And so we have this enlargement going on. And then finally it ends here at something called the conus medullaris. Do you see it? Okay, this sort of arrow head shaped thing right there. And from that there's a little piece of pia mater, which they've decided to color green here. It's called the filum terminale, and basically it comes down and it attaches itself down here. You go past the sacrum, and we're actually attaching to the tailbones right through here, coccyx area. Okay, so and then below that, now consider carefully that we have the spinal nerves coming out, but if your skeleton continues to grow, those intervertebral foramina are moving away, they're moving away, they're moving away, and the spinal cord stopped growing at age 5. And so you've got this little 5-year-old spinal cord growing inside of your vertebral foramina there, and the openings for the spinal nerves are moving away, which means you need to grow the roots, ventral and dorsal roots of the spinal nerves, so that they grow down to the level in which they need to exit as a spinal nerve. And these roots that are hanging down this way look like a horse's tail, and so we reference it as the cauda equina. So the tail of the horse right here. And it does very much look like that when you see it in a cadaver system. But you'll notice that once the roots get down to where they need to go, then we do in fact get an exit properly. And so we're just growing the roots so that they continue on with the skeletal system that's growing. Okay, so that's the deal right there. They do have some cadaver stuff going on over here, and here's the spinal nerve in the cadaver, and you can actually see the roots over here. Here's a dorsal root, and then there's another and another and another, and then on the other side there's a little denticulate ligament. Can we make it out? Yes, we can, right there. So here's the dorsal roots over here, and then on the other side, can't quite make it out, difficult to make it out. Oh, right here, look at that. Here's the ventral, here's the dorsal. Okay, just the way you like it. And basically there's a connective tissue that runs in between them that's referred to as a denticulate ligament. It separates those roots. Okay, here's the spinal cord. Anyways, everything just the way you like it there. Lots of fun to look at. Okay, so then one of the things that you must be mindful of if you're especially working in OB-GYN and you're going to give an epidural, or if you're a neurology specialist and you're going to withdraw cerebrospinal fluid, in any case, you're going to go below a certain lumbar level here, and in order to miss the spinal cord, the cauda equina roots here will get out of the way when your syringe gets in there. So the situation, if somebody is normal to moderately tall, you can go below L3. And where you're going is in between the two lamina. You're going to penetrate the yellow connective tissue here, which is referred to as ligamentum flavum. Okay, and as you push through between the two lamina, you can feel yourself pushing hard against the connective tissue. This is dense, regular connective tissue. It's like going through an Achilles tendon or something. And then finally you get to the other side and you feel a little snap and you're free. And you might want to pull back a little bit if you're delivering anesthesia, because that needs to go out on the outside of the dura mater, or you might push all the way in, and you might then enter so that you can withdraw some cerebrospinal fluid. It depends on what your procedure is. Okay, so that's below L3. Now, if you're a shorty like me, you might want to say, why don't you go below L4? And so that would be the appropriate thing to do in someone who is considerably shorter than average, is have the expectation that the spinal cord is actually hanging a little bit lower in the vertebral canal. Okay, here we have another view of the spinal cord. This is actually a cervical region through here. You can tell because it's got transverse foramina, but it has a T1 to L2 configuration here, where it has a posterior horn, a ventral horn, and a lateral horn, which only you can see at the levels of T1 to L2. So this is sort of a, how shall I say, an illustration for all seasons, as it were. But at any rate, here's where the spinal cord is situated, and this is the dorsal aspect, this is the spinous process, this is the ventral aspect, the body is right there, and we have a dorsal and a ventral root coming out this way, joining together. The dorsal is always incoming sensory. The ventral is always motor, outgoing. Okay, and then here's our primary branches. The ventral is always bigger than the dorsal primary branch. Almost everything has to do with ventral. Only certain intrinsic things have to do with the dorsal. But we'll come more into that, and you can take a look at this one. We'll pick it up here next time.